All right. So we're going to get started. Welcome, everyone. I'm so happy and excited to have everybody join us this afternoon. So I'm Angela Jefferson. I'm the Vice President of Programs here at Partnership with Children. I'm also the co-chair of our Diversity, Equity, and Inclusion Council. So I have three amazing colleagues and panelists here with us today. I am first going to let them introduce themselves and then tell you a little bit about Partnership with Children, and then we'll jump right into our second town hall, Advancing Equity for Children During COVID and Beyond. So let's start with introductions, and we'll start with Josie.
Thanks, Angela. I'm Josie Zwerdling. I'm a senior social worker at an elementary school in Brownsville.
Great. Kazim?
I'm Kazim Shanaba. I'm a social work director at an elementary school in East Harlem.
Thanks, Kazim. Jasmine?
Thank you. Hi, good afternoon. My name is Jasmine Berrios. I'm program director with Partnership with Children. I support schools, a portfolio of schools that include elementary, middle, and high schools across East Harlem and the Bronx.
Great. So again, my name is Angela Jefferson. In my role as Vice President of Programs, I also supervise and manage a profile of schools that include elementary, middle, and high schools, and schools that are in our charter school portfolio. So I'm so excited that we have folks on this call that are familiar and friends of Partnership with Children. But for those of you who may not be as familiar with us, let me just describe who we are really briefly. So we are a 109-year-old nonprofit. We specialize in providing integrated student support in schools across all the 5 boroughs. We focus on mitigating the effects of trauma as a result of poverty with our students. We provide individual and group mental health counseling. In our community schools, we connect the schools and community students and families with needed resources that address gaps in services and gaps in resources that they have. We work closely with our school principals, our teachers and paras and school staff around professional development and training regarding trauma-informed practices, de-escalation skills, classroom management. That's who we are. We've been doing this, like I said, for quite some time. And so we're happy to have you all participate and hear a lot about what we're doing in terms of advancing equity. So our last town hall, if you haven't seen it, you should definitely check out the link on our website. And so during that town hall, we talked a lot about the immediate effects of school closure as a result of the COVID pandemic. We talked about engaging our students in immediate urgent needs around food scarcity, around internet connectivity, around access to devices and academic resources, and really working with teachers to embed social emotional learning in their classrooms and in their curricula. We found that after very early sort of thoughts about COVID being a great equalizer, what we found, in fact, was that COVID was highlighting huge disparities that were experienced by the communities that we serve. We serve communities like East New York, Brownsville, Washington Heights, the South Bronx, communities that were disproportionately heavily hit by the COVID pandemic. So today's discussion, we're going to talk about how that continues to impact the students that we serve. And in addition, now nationally and globally, we are faced with the increasing movement to address racial discrimination, police brutality, and systemic racism across all of our systems, including education. So today we're going to pick up on those inequities, right? I think that the way that we start to address these issues is we start from a place of equity and understanding what that is. So to be clear, equity and equality are not the same thing, right? To be clear that the idea that we are all starting in the same place is not in fact true. And so we have to think about how we address those disparities, how we address those inequities. The communities that were most hurt by schools closing down as a result of the pandemic are also those communities that we need to be equally as concerned about when we think about reimagining schools opening and coming back. So today we're going to be talking about what those inequities are and really forging a way to solutions as we reimagine the future. So let's jump in and get started with our first question. So we're going to just explore, do what I just talked about. We're going to explore what are those daily, everyday inequities that our communities face, the communities of color that we face that are being deeply impacted by the COVID crisis. Why don't we start with you, Josie?
Sure. Thank you, Angela. So as you're saying, so partnership with children, we're really working, and our approach is really rooted in support and prevention and approaches that are working to eliminate those systemic barriers that you're talking about. So the problems that we really know about are that we're trying to fill a gap that exists in our school communities because of these effects of systemic racism, because of that leading to poverty, disenfranchisement, over-policing, generations of trauma, continued lack of investment in our schools over generations. And then we're really working on, on a solutions-oriented approach of trying to address those things. So trying to fill the gap by providing free social, emotional, community outreach, case management, all of those services that really fulfill both people's basic needs, but also mental health needs, that use healing and transformative justice approaches for our students and families, rather than punitive approaches, and centering approaches that shift the ways our schools look at our students, and try to put the onus really back on systems that have forced our families into these positions in the first place. Because all these services, as we know, are things that most white affluent communities are paying for or funding themselves, but are not necessarily accessible to our families for all those things that I mentioned because of all those things that we just mentioned. So that's, as we know, just like deepened as well as evolved with COVID. The COVID crisis has definitely deepened those issues that are specifically facing our Black and Brown students and families. And so we're really trying to make sure that the city, people that are, our champions and funding us, that our schools and staff are understanding that these compounding effects of these inequities are making the grief that our families have gone through during COVID, obviously much greater rates of death and illness in Black and Brown communities. It's actually disenfranchised grief for Black and Brown students. And that's something my colleagues, I think, are going to talk about more. But all of this is exacerbated by our community trauma that we see that stems really from over-policing and has forever since people were enslaved. Even around social distancing, which we know was only enforced violently in communities of color, like Brownsville, where I work, that got viral in the news. And at the same time, our families are continuing to hear about the deaths of more people that look like them every day at the hands of police. So we're really trying to support by working to make things more equitable for the students in our schools and the children by offering wraparound services through our amazing clinically trained social workers, but also through our family outreach workers who are amazing, and our community school directors who really are, huge voices and for our community. And then our staff works to fill all of these gaps that we're talking about. So we bring free dental and vision services. We distribute school supplies, snacks. We provide space to take breaks because, the daily grind of the traditional classroom is really not a place. I mean, how many of us adults can even sit in just one place all day, let alone kids, right? And especially when it's curriculum that might not be applicable to their lives, and then supporting staff to really address behavioral challenges by providing restorative methods rather than just bringing in all these disciplinary codes to address conflicts and harm. And then finally, just by bolstering school-wide systems and engagement with families and students in exciting ways. So we have all kinds of fun stuff we do with the kids and staff, different assemblies, different attendance parades, all these things that are relevant to people's lives and help make sure families have the tools they need to advocate for themselves. Because, at the end of the day, we really just want to empower the communities we work with to lead the way themselves. Thank you.
Yeah, thanks, Josie. I mean, I think that really speaks a lot to both why inequities exist, but what we, a partnership with children, are really focused on providing community students, both students, communities, school communities, and the communities at large with services. So Kazim, do you have any thoughts about this? You know, what are those daily inequities that you're seeing in communities of color and the communities that you're working with?
So I think Josie touched very beautifully about a lot of the inequities and how they manifest in our schools. Something more specifically that comes to mind when I think about that is the school to prison pipeline. It's very well known and documented that if children don't reach certain metrics at a certain grade level, that they're almost essentially funneled into the prison system. So to illustrate a little bit more, we have school safety agents in the school that I don't think are necessarily trained across the board to support the needs of our students. So I can give you an example. If a student is acting out in the class where he's throwing things in the classroom, it's not so much to police that child, but that child's behavior speaks to a need. What does that child need? And as opposed to apprehending the child, it's really helping that child to de-escalate and find the need of that child. For instance, in my school, I've able to collaborate with the principal and other staff members to create a space in which we're able to help children de-escalate and then really meet their needs, so that in the future they have coping skills and mechanisms to help them come back down. So I think to Josie's point, a lot of points that she touched upon is really looking at these all the inequities that our families face in terms of just being trauma informed. If we know that trauma exists, we know how it's going to manifest and how we can best support the children and their families.
Yeah, thanks, Kazim. And I agree with that 100%, right? We all know that in this field, when we train our staff in de-escalation strategies and trauma-informed practices, we know that all behavior has meaning and that behavior reflects needs. And I think you're absolutely right, that we want to understand what needs are being expressed through different behaviors and how can we address them. That leads nicely into our next question. You know, what are some of the essential ways, or why is it so essential to interrupt the long-term impact of COVID on mental health, physical health, and on racial disparities that's been highlighted during this pandemic? I think I'm going to go this time to Jasmine to share with us your thoughts.
Thank you, Angela. And, I think the word interrupt in this question is really key. This pandemic has awakened and intensified the impact of intergenerational traumas linked to decades of systemic oppression and inequalities and exposure to toxic stress like poverty and the accumulated burdens of economic hardships. Not only have our children and families been experiencing tremendous health disparities in this, but we're also seeing widening opportunity gaps with proven inequities around online learning. For example, you mentioned it earlier, we're seeing issues with access to technology, including devices, Wi-Fi services, a lack of training, a lack of support for our families in how to use these items once they get them. We're also seeing language barriers. Once the families get them, if they're not English speaking, it's hard to kind of navigate a device that doesn't, communicate with you in your language. Thinking about how that impacts how our children are able to connect with their teachers. They're missing out on direct learning from direct instruction from their teachers, often, if they can, receiving packets, but many of our kids are not even getting those packets, and then wondering, are they gonna have the assistance to be able to work through those at home? We're already seeing results from research showing that the average academic loss right now is 7 months. But when you look at Black and Brown students, that's already 2 to 3 times greater. So in those communities, it's looking like the learning loss is more like 9 to 10.5 months. And then when you look at low income communities, we're showing numbers of even greater than a year's worth of learning loss that we're seeing already. And that's, today's the last day of school here in New York City. So all of these factors compounded with things that Josie mentioned in terms of disenfranchised grief, losses of deaths, but also routine, work, finances, so many other things that are just compounded in all of this. You know, those are also preconditions that can lead to traumatic and other adverse childhood experiences. And while the preconditions are currently in place, we also have tools right now to mitigate them and to interrupt the negative effects of these conditions for future generations to come. You know, often times of crisis also create spaces for opportunity. And, you know, if organizations like us don't intervene, the effects of compounded trauma will echo for years to come and will only continue to widen racial and economic disparities.
Yeah. And I just want to, you know, highlight a little bit about what you commented on. So for those who aren't familiar with ACEs, adverse childhood experiences, you know, we've known for a long time that experience that happen in childhood can have long-term effects on health outcomes, on earning outcomes, ability to be as successful as we all want to be in our adult lives. And there is a lot of concern that the COVID pandemic will in fact be referred to as an adverse childhood experience for our current school-age children. And like Jasmine said, I think that we know what the tools are. We know how to interrupt those reactions and disparities that are a result of adverse childhood experiences. And we want to make sure that we get those kinds of supports and resources in place early on. Not that we're not talking about this, you know, 5 years from now, but we're utilizing these resources and services now. Kazim, what would you add to kind of this sort of thought of interrupting long-term impact?
I think when we're thinking about that, like, I think us as the clinicians, we're here to kind of like mitigate some of those impacts. But I often feel like and I think a lot of you guys can agree, like in the field of mental health, we're often forgotten about. I think that comes with the work. Like a lot of times when we're having those one-on-ones with our clients, folks can't really quantify the work because they can't see it in real time as it happens incrementally. And I think with that, even considering what's happening with COVID, as you just said, it's another layer of trauma that's going to occur. And we're going to be overwhelmed to the brim supporting some of our families. For instance, right now, my own team, we're already at capacity. We need support as is. So I can only imagine as this next school year unfolds, we're going to need more support in terms of just staffing, in terms of just like trainings to best support our families.
Yeah, absolutely. We have to really think about driving support for our communities. You know, prioritizing the hardest hit communities. You know, if we think about the New York City school system, there are zip codes that we can identify that have been hardest hit by the COVID pandemic, which are then also the same communities that are hardest hit by police brutality and systemic racism. And if we think about it, there are more than 800 schools in those zip codes. So we're talking about a lot of young people, a lot of students, a lot of families, a lot of communities. So when we're thinking about driving support to those communities, it is a Herculean task that we are engaging in. And I know that some of our CBO brother and sister organizations are on this call, and we're all in this together to really start to mitigate these effects of the COVID and uprising around systemic racism. So Kazim, you make a good point, right? Our staff is at capacity. We are doing all that we want to and can to serve our communities. But we want to think about our staff, right? We want to think about how a staff that is 74% people of color, who are experiencing the impact of COVID and injustice around systemic racism personally in their own lives, in their families, and for our students also in their families, and in many cases in their schools, their teachers, their school staff. but how do we think about how this is affecting the climate and culture of our work? And we'll stay with you, Kazim.
So I'll provide an example. I'll use myself as an example. So like I grew up in public housing, and then like as growing up, I always felt as if like something was kind of off. I never really understood why like certain things were the way they were. I kind of felt certain equities in life. And I always I think that probably led me to actually get into this work. But just, when I started thinking about the protests and like just the recent like deaths of Black people, I became angry for the first time, and I had to sit there and think about it. And I think I became angry because growing up in the projects, you become so desensitized to these things. And I got to a point where it's like, I want my experience to be validated. Like I exist and what's happening to me matters. So I also think about the work that we're doing in the DEI Council, and just we're trying to push forward this anti-racist agenda. So like all the work that we've been doing in our organization, I take that over to my particular school, and I think about like my principal and my staff, like how are we integrating these conversations and validating the lives of other children that we're servicing in their families, because this is happening to them. We can't work in isolation. Like this is happening to the children. We can't just teach kids math and people are dying in the streets. So I think the way that looks like is supporting the staff with providing like culturally competent material. For instance, I've been collaborating with a teacher at my school to form a culturally competent book club for the staff next year. So we're able to like support the kids in a different capacity.
Absolutely. And I think that we are finding that because we do have, as an organization, a bit of a head start in our diversity, equity, and inclusion work. This is something that we embarked on 3.5 years ago, that we are hearing from our principals that they understand that they can't tackle this on their own, and that they understand the work that we've been doing and are wanting to use us as a crucial resource during this time. And this time of funding cuts and decreased resources and the city budget that's going to come down and sort of dictate cuts in education. We really want to be thinking again about strategizing and recognizing those 800 schools in those hard-hit zip codes, and who and how is that work going to happen. So I think let's go to Josie and hear a little bit what you are thinking.
Yeah, so thank you for sharing all that, Kazim and Jasmine. So we're really trying to collectively like re-envision, right? This is a reimagining. We need to build a new way. We need to build a lot of new ways. So we're really trying to collectively come together and envision a reallocation of funds from the police to a deeper societal reinvestment in dismantling systemic oppression, reimagining a healing-centered or trauma-informed model to drive and support equitable opportunities. And so to do that, we really need to advocate for resources for more mental health work and for more social emotional supports, because people have been through the ringer, right? And then also bolstering our case management and basic needs support in schools, because like we all said, like there's no way students can learn if we're not making sure their basic needs are fulfilled and that they don't feel safe and fed and housed and all of those things, right? And we already know, like from this work we've been doing for a long time, we know that those are the strategies that really work in the long term. That like we said, that students can't learn or work if like their families are struggling with illness, with medical bills, with housing, with food, with family members being incarcerated, disproportionately brutalized by law enforcement. Like there's really no way that they can learn. So we really think that like we can be huge assets in offsetting those challenges and serving as alternative approaches to what has been happening. I think social workers, we often hopefully do bring a lot of hope and like ideas for solutions, which is nice to be in that field. So it's actually been amazing to talk to teachers, families recently, get a lot of good feedback about our work together, and learn that even through all of this, through all these really heavy, depressing, things that people have been going through and violent things, students that have been on our caseloads are actually like making a lot of progress socially and emotionally due to the teamwork between caregivers, with us, with school staff, and making sure families have what they need, both mental health wise and basic need wise materially. So that's encouraging.
Yeah. And Jasmine, would you add anything to what your colleagues have already shared?
Sure. Yeah, I think, in hearing both Kazim and Josie talking, I also think about, as an organization, how committed we are to really understanding, our staff experiences and how they're experiencing the work and how can we be supportive of our teams. And I think about, as Josie was talking about, all the things and the ways that we are supporting our families, that it extends beyond the student to the families and to the school community, including school staff. And, as Kazim highlighted, that our teams are also simultaneously experiencing everything as well, right alongside the community. And it makes me really think about and wonder, how are we supporting them beyond what we've been doing in terms of supervision and training? When I think about our social workers are currently carrying increased caseloads, right? They're creating healing spaces, they're providing social emotional supports, they are, supporting a multitude of experiences, from stress to grief to trauma, discomfort, anxiety, depression, just to name a few, right? And still engaging in ongoing advocacy efforts, and still, simultaneously offering healing. When essential workers and essential frontline workers were being identified, when this all came about, they highlighted healthcare workers. And mental health workers, social workers were not included in that conversation as part of a healthcare team. And I think that really highlights the existing and continued stigmas that are around mental health, and not seeing it as both a normal and an essential part of healthcare. And, in thinking about frontline work, our teams have always and continue to be doing that frontline work. We have been there from the very beginning. When the COVID pandemic starts to settle, we will continue to be there, still doing the very needed and necessary work that will continue way beyond, right, the immediate, what's happening right now. And, they've talked about hazard pay, right? Because being in the front of this certainly has some, hazards that come with that come from that constant exposure. I think about folks in the helping field and how they are, at a higher, they're more likely to be affected by things like compassion fatigue and vicarious trauma. And thinking about how are we supporting and offsetting the effects of compassion fatigue and vicarious trauma, and what would hazard pay look for mental health workers and social workers?
Yeah, absolutely. I liken it to, folks who refer to first responders. And I often kind of joke and say, we're first, second, third, fourth, fifth responders, because we stay, right? Sometimes the immediate work, and I applaud our first responders and essential workers. I hold them very, very close to my heart. And that work is necessary and needed. And then we are there during that time, and then we remain once the immediacy sort of subsides, exactly how you said. And I also remind people that not only are, there aren't a lot of moments in time where a national uprising in terms of police brutality and systemic racism, or a global pandemic, both impacts us as social workers individually and personally, and then call on us to hold space and provide services for large amounts of people and community. So when we think about that, folks who on our staff who quite literally would have to be concerned about family members in hospitals, and then talk with students who may have lost a parent. And so imagine that impact that social worker may be experiencing. So, you know, like we talk about, we're in the business of doing everything, right? We're concerned about mental health. We're concerned about individual counseling. We're concerned about school communities. We're concerned about the community at large. And like we talked about, we try to really tackle all of those early on, very urgent needs. But there are times where that work is difficult to quantify, right? It's difficult we can talk about the number of families we impact, but we can't really talk about in a quantifiable way the impact of that, the emotional impact that's being had on people as a result of our dueling crises that we're experiencing. Before I shift to the next question, I just want to remind folks that we really do want to hear from you, and if you have questions. So I want to remind people that you can use the Q&A function on your screens and type in some questions, and we'll have a portion at the end where we will pose your questions to our panelists. So don't forget to do that. We want to hear from you. Okay. So we're going to jump right back into our next question, which is summer. You know, we jumped into remote and distance learning very quickly, mid-March. And then very soon after that, we started to think about summer. You know, what was summer going to look like? When we think about equity in summer, and what is that going to look like? Some of the early resources that were provided to families to help with distance learning are starting to go away. You know, discounts in terms of internet connectivity, availability of devices and things like that are starting to, you know, sort of trickle away. You know, we know that equity in terms of the literacy gap still exists. We know that fewer jobs, summer youth employment being cut. We know that there's just the fewer resources that are available to students. So what is possible for the school system now and in the fall to ensure that students don't fall through the cracks further? You know, we talked about learning loss and gaps. You know, how do we think about further mitigating the trauma that may be perpetuated during this very volatile time? Let's start with Josie.
Yeah, so a few things come to mind, and I think Kazim and Jasmine would probably talk a little bit more about that, because there's definitely programming that we are continuing through the summer as social workers in schools that we normally take a break from during the summer or have a much lighter load on, but we're actually going to continue those services to keep families connected. But one thing I'm actually thinking of on sort of a macro level is that we in our agency and partnership, we're actually working at, for those of us who are white in the organization, to work towards equity for our students by working on ourselves. So that, you know, we've been kind of working towards this for a long time, having white affinity groups within the organization that really build an anti-racist tool belt, and really have DEI efforts that are geared towards that for reflection and action. And then we hope that creates a ripple effect, right? That we educate our white family and community members, because we really know that that's a precondition for white people working in Black and Brown communities. We need to be doing that work on ourselves to be the best allies and accomplices we can be, and to prevent, you know, doing any further harm. And then also on the, you know, on the more direct level, I really think it's so important that we're advocating for as equitable a school reopening as possible. The reopening feels very fraught to me. So that's why I'm going to be like joining my principals committee on reopening to just really bring as many voices to the table around advocating for the most equitable policies possible, thinking about what our families can even handle, because there's all these possibilities, right, of half days, of hybrid schedules, of still having some remote learning and some in-person learning. But how do we, you know, sort of navigate that with a lot of different children maybe living in the same household and caregivers having to go to work, right? So for caregivers working an hourly job, right, they may not have, you know, the ability to pick children up at different times, drop them off at different times. And then there's children living with immunocompromised folks, as well as many children who are being raised and brought up by elders. And that's, you know, another huge risk for coming back to the building and being exposed to COVID. So we really think that even with the lower numbers of folks being considered to be indoors together during that time, we're going to really have to take all of these things into consideration. And then all the things Jasmine was saying about, you know, tech challenges, that it's not just like, okay, here's an iPad, now you can do it. It's beyond that. We have to really be empowering people with skills and tools. And then lastly, we just are going to really need robust training for our staff, and I'm sure for all mental health and social work staff across the city, to really be prepared to deal with all these compounded problems and challenges that have come up since COVID, and also with the uprising and with the really visible revealing of all the police brutality that people are going through, and the deaths they're, you know, seeing. And with those expanded roles, just want to reiterate Jasmine's point, like, as frontline workers, I think there really is going to need to be conversations about hazard pay for that extra work and risk as we go back to buildings, especially.
Yeah. Kazim, let's hear from you a little bit.
I think something that Josie had touched about in terms of like the families, I think our vision in going into the summer is most definitely going to be supporting the families. So for instance, something that I've seen during this whole time of like learning like remotely was that a lot of the family structures were kind of highlighted how a lot of them were like kind of like broken in the sense that like they're spending more time with each other, and like parents are struggling to kind of like support their children. So with that, we're going to have ongoing counseling to support our children and our families as we go along in the summer. A lot of like just case management and coordination of services for the families as well. They're going to need that as well. I think a lot of strategic planning for the staff, like the school staff, for instance, a lot of professional development around supporting children in regards to COVID, and a lot of support groups for the staff as well, because they're going to need it as well. So I think those are some of like the items that folks are focusing on moving into the summer for the fall.
Yeah, you know, and I want to just kind of highlight a couple of things that both of you brought up. You know, this idea of training and the robust training that's going to be needed. So training for our existing staff. You know, I talked a little bit earlier about de-escalation training that all of our staff receive, and you know, this is a training that we provide to all of our school-based staff. We have to have trainers that are trained to provide this training in-house, but it's an expensive, you know, endeavor. You know, we committed to, you know, a cost of $2,000 per trainer that needs to be recertified every few years. In order to train our school-based staff of, you know, 70 plus folks. You know, it's important to do, and we share that then as much as we can with our school colleagues, but training that they need then is an additional, you know, sort of capacity endeavor for us. And so we know that our staff in-house needs the training, but we also know that it would be beneficial for everybody. The more people that are trained in particular de-escalation or other strategies, the better off our students and families are. When we talked earlier about behavior having meaning and that behavior reflecting needs, you know, that kind of language, that shared language and common understanding comes from robust training. You know, when we think about the summer again, and we think about reimagining opening, you know, Josie, you mentioned being on your school's reopening committee to really kind of elevate the concerns and voices of students and families. You know, one of the things that I want to highlight for us is that our Chief Executive Officer, Margaret Crotty, is participating on the Mayor's Task Force to ensure the interests of our children and families are being represented on a larger scale. You know, our staff are doing it school by school, if possible, but this is a really important task force to be a part of, to make sure that all of the students and families that we serve, that their needs are being highlighted. You know, and a new way of working is happening, it's developing, it's happening as we speak, right? It's the analogy of building the boat while you're at sea, right? It is happening as we sit here in this conversation. We are all charged with reimagining what is going to happen in the fall. And as an organization of social workers, we want to be intentional about all of that, including our stance around anti-racism work, including our stances around educational equity. We want to look to our champions and supporters that will enable us to continue this work, this opportunity for all of New York City students. And so, you know, I guess I want to kind of throw it back to the panelists. Maybe Josie, if you have anything else you wanted to add to that.
Yeah, so we've really just, I think, been thinking about how do we expand our roles, right? A lot of the calls right now in the uprising and protests going on are to have more social workers and other support staff in schools, that we work together as a team to really replace the role of police and school safety officers in our schools, because why do we don't want to be policing our students, our, you know, children in these communities. So we really need that, like you all have said, like we just need such much more thoroughly trained alternative staff in the school, both, you know, our staff and other support staff who have gone through special training, who have gone through therapeutic crisis intervention in schools trainings. That's what I believe you were talking about, Angela. And then have the skills to like really replace those police. And then we don't want to become another form of policing, right? I know Jasmine has like talked about this too, or might talk about it more, but in our role as social workers, we're often like pushed to be complicit with police or with Child Protective Services, or ACS as it's called in New York. And not to, you know, knock the you know, people at ACS who work really hard and try to do preventive measures. But, you know, we don't want to be complicit with other forms of policing. We want a reimagined role where we really support students and families with really profound de-escalation, with like case management to get them the services they need, with mental health, with community outreach, with transformative justice skill sets. And so, you know, as we're coming out of COVID, we're not really, but, you know, in the post-COVID world, hopefully, please, when we come out of COVID world, we want to really continue and deepen that preventive work, right? And we want to de-escalate conflict. We want to work with teachers so we can red flag issues rather than simply becoming another form of policing our families. So yeah, so I just, you know, we're really investing in mental health, a holistic approach to supporting and empowering our families to break through and resist, right? These cycles of systemic racism, of intergenerational poverty, of disenfranchisement, of ancestral trauma, right? That's at the core of our children that we work with of their trauma and barriers to success. But if we can really empower folks to resist and break through that and then work on ourselves and the systems that create that, I think we can really get somewhere.
That's great. And I think that, you know, just to sort of further highlight and elaborate kind of what you were talking about around over-policing and involvement with child services. And I want to echo that we support our colleagues in terms of child welfare and abuse and neglect, but we also find that there have been times when we talk about being complicit, there are times where poverty gets mistaken for abuse or neglect. And in terms of like mitigating that and providing resources that address some of what then gets interpreted as neglect is really a need that a family has, right? So we want to make sure that we're clear about what's happening with families, what support they need, so that we can advocate for them. So we are, you know, sort of at, you know, a point in our town hall where I want to shift us a little bit. We've talked a lot about the inequities. We've talked a lot about, you know, what is sort of driving the impact of COVID and our uprising around racial justice. You know, I want to kind of think about, you know, before I ask this last question, I don't know, Jasmine, did you want to add anything to the prior question? Just want to make sure that I get everybody.
You know, what was just yelling out for me is, as Josie was talking, was about, you know, the sustainability of it all, right? Like, this is really great. And like, it's inspiring to think that this is now an opportunity, you know, to really reimagine and reinvest in that new, you know, creation moving forward. But it's also just like really important that we understand the importance of creating things that are sustainable and really, you know, having partners alongside us. And Angela, you mentioned champions who are partnering with us and supporting the work that's needed and the investments that are needed in order to create something that is going to be sustainable. And that was just like resonating for me. And it's inspiring to think about what can be and how things can look when we truly invest and make sure that every part of the system that's working has the support needed to continue the work in a way that's healthy.
Yeah. Yeah, and that sort of brings us to kind of I'll wrap up a little bit. I'd like to invite all of our speakers to kind of share any final thoughts. You know, I think that as social workers, and I think, you know, we talked a bit about the disparities and the inequities and kind of the despair that families and communities are feeling during this time. But we also want to remember that one of the key things that we do when we talk in a partnership, we often talk about shining a light or holding a candle, and instead of kind of raging at the disparities. That is a useful thing. Sometimes the raging at disparities is useful, but how else can we sort of instill this idea of hope and moving forward? We talked a bit earlier about mitigating some of the impact of what could be adverse childhood experiences, but what other thoughts do you have? And so we're just gonna go, you know, we'll go to Josie first, we'll go to Jasmine, and then last but not least, we'll kind of wrap up with Kazim's thoughts.
So one thing that really gives me strength and makes me have hope when it seems like all is lost is that we already have a really beautiful foundation of trusting relationships in our schools, with our school staff, with our the students we work with and their families. So with this like reimagined vision that we're discussing, with this investment in healing centered or trauma informed approaches, and with the expertise of all of our staff, of our social workers, community school directors, family outreach workers, and our own experience in advocacy work through DEI initiatives at Partnership, I really think we are well positioned, you know, along with other mental health workers and social workers in the city, to really supporting our students and families and staff to like successfully navigate into a better future, right? And so we just want this approach, and like the approach of a lot of our schools are community schools, so we really want that approach to be leveraged in all of our New York schools. Like we want each school to have a really strong team of our staff, of other social work and alternative and mental health staff, just ensuring that our students and caregivers have the access that they should have had, right? Have access to fulfilling their medical needs, to other basic needs, to doing family engagement, to community outreach, to mental health and social emotional wellness work, right? And so we just want to really make sure that the communities we work within are also the voices centered in and leading this work, right? We think there's no other way to advance equity for our students. We need to be drawing directly from the communities we work within to hear what they feel we need to do to move forward.
Great, thank you. Actually, we're gonna go over to Kazim to share his thoughts, and then we'll circle back to Jasmine.
I mean, I think as clinicians, like, I think the investment is hope. Like, we do this work because we invest in hope. And I just think that, you know, we have to look at ourselves and our respective privileges and just think about, like, what privilege do I have that I can help shape and change the world? And, like, even anyone that's on this conversation, on this call, like, what privilege do you have? How can you contribute to essentially restoring humanity? Because that's the work that we're doing, to restore humanity. So that's, I guess, my mindset as I work and just what I challenge people around me to kind of think about and to do.
Yeah, restoring humanity. I think that's an amazing thought. Jasmine, what would you add?
I mean, I want to say ditto to both what Josie and Kazim shared, and I agree wholeheartedly that this is really a time to, be in reflection and take steps forward. It's a call to action. It's a call to, what's my contribution in this, and really taking those steps forward.
Yeah.
We all have something to bring and give.
What was that?
We all have something to bring and give to this.
Yeah, absolutely. Absolutely. So I appreciate all of your thoughts. I agree wholeheartedly with the idea that we are in the business of hope, in the business of taking a look at all of what we're facing. And a lot of it is hard, but we really want to look to what we can do to support. So we're going to shift now. So again, I want to thank Kazim, Jasmine, Josie for being here this afternoon. I want to thank everybody on this call for being here this afternoon. We're going to shift to our Q&A, but I want to introduce my colleague, Marielle Mejia, who is kind of a voice that you will hear, who will take us through our Q&A. So Marielle.
Thank you, Angela. Thank you, everyone, for being here. And thank you to my wonderful coworkers. So we're just going to jump right into questions and be cognizant of everyone's time. The first question that we received, or one of the questions that we received, is specific to our children with special needs. So the question is, what about the effects on children with special needs who are being affected by systemic racism in the education system and are only given minimal resources?
Yeah, that's an excellent question. There's been a lot of concern and talk about that. Those students who their services didn't necessarily translate well into distance and remote learning. Is there one of the panelists that want to take a stab at that? I'm actually, just in the interest of time, I'm actually gonna ask Jasmine to share her thoughts on that.
Actually, can I pass that over to Kazim? I saw Kazim's finger go up. I want to throw it back because I'm confident in what Kazim has to share there.
I mean, something struck for me. So before the pandemic hit, we had like a committee, an equity committee at my school, and we were discussing and looking at how ways that children of color are often like misdiagnosed or diagnosed in a way that whoever is doing it is leaving out the understanding of the child's background. So with that particular question, I can only imagine during this whole time of the pandemic, these children have fallen behind even more and they're just being lost into the system. And I just think that I'm glad to hear that folks across the board are thinking about ways to be more equitable for the children, but it has to be a greater investment because, I mean, you're looking at a kid who's probably in 5th grade who's probably been misdiagnosed, but what happens after that? Like, we had to do a lot of this work earlier on. So I think a lot of our conversation encompasses what we need to do moving forward around like being culturally competent in diagnosing our kids or understanding that this is actually just this, the child's dealing with trauma. So I'm not sure that answered your question, but that's something that, at least in my school, has been talked about.
Yeah.
Thank you, Kazim, and Angela, and Jasmine. So in the interest of time, we have time for just one more question, and we want to end on a positive note. So another question was submitted, and it reads, what continues to inspire you in your work at PWC?
All right, who wants to take that one?
I mean, I could go, or Jasmine, if you feel moved.
Go ahead, Josie, you got this.
Well, it's sort of a combination of this and the last question, because a thought that came up was like the support we give families right now that are home with students with special needs is so super important. I think like so it's been really special to build these really strong connections with family members that maybe we see sometimes in school. Maybe we have closer relationships with certain family members than others, but to really provide that support and make sure they're linked up with all the resources they can get remotely or when they're back in school, making sure they know how to use the technology they have to keep the services going for their students. And I've seen so what really inspires me is what I'm trying to say is that there's like a student I'm thinking of in particular who just graduated kindergarten, who I adore. And it's been super awesome to work with his family to make sure all of his services are coming through on technology. And I'm seeing so much progress during this time, which is crazy. He's just speaking so much more clearly, speaking his thoughts, able to focus, able to engage. And it's just that kind of work and that kind of progress, even with all the trauma I know he's been through. That's really encouraging and inspiring to me to see this teamwork that we've had and how that's still led to progress even through all of this.
Yeah, and I would just add in closing that what inspires me is working, not just, I don't want to be cheesy or trite, but very, very seriously working with all of you and hearing the stories of our families and the resilience that they have shown during this time. There's one student that I think of that I was told about that wasn't showing up to school at all. And then we went to distance learning, and when working with a social worker, slowly started to show up to online classes and engaged with her students, her classmates and teachers, and the social worker in a very different way remotely than she was able to do in person. So those kinds of stories really inspire me and keeps me engaged in this work. So we are just over 4:30, and I want to respect everybody's time and just thank everybody for joining us once more. And I hope this has been a helpful conversation for you. Thank you once again to Kazim, Jasmine, Josie. This has been a great conversation.
Angela, for facilitating such a wonderful.
Thank you.